CBD has been shown to help stabilize, to help balance those blood sugar levels. So when you have a diabetic, they're usually going through these massive fluctuations of highs and lows. Blood sugar is up, now it's way down. It's back up. You take insulin, it skyrockets down. As your blood sugar levels are going up and down, so are your insulin levels. So one thing that happens is CBD helps to stabilize blood sugar levels, or may help to stabilize blood sugar levels. When we stabilize blood sugar, we stabilize insulin. When we stabilize our insulin, it has a very beneficial impact on other hormones, estrogen, testosterone, all those other things. So that's one way. The second way, and this is according to that government patent that we discussed in the previous podcast, where specifically they referred to it as a neuroprotective antioxidant. So this is really important because CBD is a neuroprotectant, it may help alleviate nerve pain caused from chronic inflammation. So imagine all those little sugar particles going around and creating something that we call AGEs. It's called AGE''S. These are advanced glycated end products, okay? These are literally the chemicals from inflammation that we see in diabetes that make us age. How do you beat these things? By taking an antioxidant. CBD has been shown to be just that. It prevents oxidation. So CBD is also being shown to be antispasmodic. In your gut, you have a lot of receptors for cannabinoids. A lot of people with diabetes suffer from GI spasms, or even just your day-to-day muscle spasms at night. I can't tell you the amount of diabetics patients that we work with the leg cramps in the evenings. CBD is shown to be an antispasmodic type supplement, okay? It may help with that. This one's very important because of the elevated risk of cardiovascular disease with a diabetic. The fact that CBD seems to have a vasodilating effect, it expands those arteries, allowing for more blood flow. This is great when it comes to helping promote a healthy blood pressure, or even helping promote healthy cholesterol levels. I can tell you I take good care of myself. I always had high hypertension, runs in the family. Couldn't do anything really about it for years. Even with good diet, we could get it down. I've been very fortunate in the time that I use CBD, that has stabilized quite nicely. I don't see the fluctuations. That was one of the many good experiences that I had with it. Now, again, do I exercise? Yes. Do I eat healthy? Yes. Is that a guaranteed result? No. Can I tell you from what I do, and I pay attention to the things I do, I believe that played a big role. And last thing too, anything that will help a diabetic with arterial inflammation, and CBD does just that. In our other podcast, we talked about inflammation in the arteries related to a protein called C-reactive protein, a protein that's released. Clinically right now, there's not research saying that it decreases C-reactive protein. I just don't think we've found that research yet. I'm not going to be surprised if in a few years, that's one of the claims that's made about it. We know it does so much for inflammation. I'm sure we're going to see that in the future. And that's really it. I suppose the other big thing too, and this is important, especially for patients who are on insulin, when you do take CBD oil, it may lower levels of fasting insulin. What does that mean for the diabetic patient? They may wind up needing less insulin. And this is a beautiful thing. Diabetics struggle to lose weight. And I feel bad because it's not entirely what they're eating. They get told, oh, eat better, it's what you're eating. If they're pumping insulin all day long, and we're talking about a type 2 diabetic, it's almost impossible to lose weight because insulin's job is to store things as fat, specifically as something called white fat, visceral fat. So CBD oil works to help promote healthy insulin levels because clinically it has been shown to turn white fat into something called brown fat, which actually can help support healthy insulin levels. I'm sure in the future we're going to see that it probably helps to lower them. So I do say that as just an awareness for our diabetic patients on insulin. You really do want to be working with your doctor because there's a chance that you may need less. Of course, this isn't a free-for-all. One thing I hate to see is someone starts to take insulin or they take CBD or whatever it is, and they think, oh, I'm going to take CBD oil, but then I'm going to eat a cheesecake. It doesn't work that way, okay? So just something to keep in mind. And the type 1 diabetic, that's an autoimmune disease. So in autoimmune diseases, the body recognizes itself as dangerous, okay? So in rheumatoid arthritis, your own body's immune system attacks your own joints. And in type 1 diabetic, your body's immune system starts to attack the pancreas. And when that happens, your pancreas can no longer release insulin. And that's why type 1 diabetics have to be on insulin because their pancreas has been destroyed. So they don't have that ability. The beautiful thing about CBD and potentially type 1 diabetics is it turns down that overactive immune system. So what they're starting to study is, okay, if we use CBD in a type 1 diabetic, can we get that person's immune system to stop damaging this individual's own pancreas? So that's one of the things we're looking at, or that you're starting to see. And I think another one is potentially going to be, hopefully these patients may one day need lower levels of synthetic insulin or insulin pumps. But really, it's to turn down that immune system, that autoimmune reaction in the type 1 diabetic. So it's that standard serving size between 10 and 100 milligrams. And it's really going to vary patient or in clients, if you're talking to clients, or patients, in my case, patient, because if that person's eating healthy, they're probably going to need a little bit less, because that CBD is going to be all the more effective. If they're on insulin, they may need a little less, or we're going to approach it really cautiously. We're going to work up really slow. If they're on metformin, we're going to work up really slow. Because if we give them too much, and let's say it does have a very beneficial impact of stabilizing blood sugar levels and maybe dropping insulin levels a little, we don't want that person to pass out or to get dizzy. And this is super important, especially for our viewers who maybe just went and grabbed the CBD from the gas station and have really no concept of what they're doing. They really need to pay attention to that. Again, I say this all the time. This stuff does work. There's no doubt about that. But because it works, you want to be knowledgeable on it and just exercise some caution. So yes, we recommend a standard dose. 10 to 100 milligrams is where you want to start. Work your way up. I would say most patients that we deal with who have begun a healthy diet, where they've really begun to make positive lifestyle changes, I would say they're right around 40 milligrams a day seems to be a nice number for them.